Hi everybody, I'm Ian Harvey, massage therapist. This is my friend Rachel.
Hi.
Today we're going to be working with the low back. There's not a lot of mystery in how to deal with the low back, but there might be some tricks that you'd like to know. As always, I come at this from a myofascial perspective. People ask me, they say, Ian, how do you work with the low back from a myofascial perspective? And I say, first of all, how do you know my name? And then I say, the same way as everything else. Slowly, patiently, and without a lot of oil. I'm just using a few drops of PSIS. It's got menthol in it, and I don't know, it's good stuff. Very even glide, not a lot of slip-stop. And you'll notice that I'm ignoring the drape line a bit. I'm going a bit past it, which I know is verboten. It is forbidden. But I'm not going far past it, and if you have had a good discussion with your client and you talk to them about why you would want to go down onto their hips as you are working with their low back, then there shouldn't be a problem. I do like to say, let me know if I'm ever in your personal space. Seems to do the trick. People know exactly what that means. So I'm going to start with a slow traction of this fascia inferiorly. This thick white lumbar fascia hooks into much of the musculature of the back and of the hips. It hooks into the spine, it hooks into the SI joint. If you can get the structures related to this lumbar fascia to chill out a bit, then this low back is going to be happier. As I get down to this stopping point, I come out laterally. This spreads the fascia around the ilia, around the iliac crests. Now, myofascially speaking, I should be starting up at the shoulders and working my way down, at least some of the time, but I did that earlier. So you can start your strokes down here. Just engage that fascia and give it some traction southward. So some tricks that you might not know would be to mold to the surface of your client's body. My hands are changing shape every second based upon what's under them. And I'm applying good pressure across my entire palmar surface until I get to about right here. I'm right at her PSISs, her posterior superior iliac spines. And I'm sinking in with my heels of hand. This is providing lumbar traction, not to the fascia necessarily, but to the spine itself. If you're too sharp with this, it can be painful, but if you mold to this superior iliac region, it will be fine. And I'll hold this for 10 seconds. If I feel like it, I'll hold it for 30 seconds and see if I can feel some melting or some lengthening of this lumbar spine. And then you can come down to either side like this, using the heels of your hand to track out laterally. We're kind of stripping down past these iliac crests. We're mobilizing this lumbar fascia laterally with every stroke. Okay, now I'm going to think mobilization. Mobilizing is a perfectly good thing to do in myofascial release. we're moving this thick white fascia over the underlying structures, creating friction on a deep level. We're also causing these hips to move. We're causing the different portions of the pelvis to move. So we're mobilizing the pelvis, we're mobilizing the lumbar spine, and we're working into the fascia of the QL. Okay. When I come around unilaterally, I'm going to start focusing on this QL fascia. Okay, so to start this, I'm going to do one of my favorite myofascial things, and it's going to be one fist next to another. So I'm going to start by pulling the fascia toward myself with the flats of my phalanges. Once I've cleared the spine, I'm not going to press down directly on the spine, I'm going to sink in with my punching knuckles, my metacarpophalangeal joints, and I'm going to draw this tissue toward myself as well as sinking toward the ground. A good point to stop here would be right about here. I'm not squishing the skin, I'm not pinching the skin under my knuckles. I've stopped short of that, but I am keeping that traction in the fascia. And as Rachel continues to breathe, that's going to create some movement in those underlying structures. So she's going to do some of the massage herself just by breathing. We can spread the fascia, so hand over hand. And this can be as slow as you like. You can hold once you get about right here and wait to feel a softening of that tissue under your hands. If your wrists are at too extreme of an angle, you can bring them to a more neutral position. And to come out of this, I come out laterally like this. If I wanted to do some trigger point type work, I could sink in with my paired up thumbs in this hollow between these floating ribs and the iliac spine right here. I'm going to show you this using a single thumb just so that you can see what's going on. Two thumbs, it looks like this. Same thing, only less visible. Use as straight a thumb as you can. You want to use thumbs that you could do push-ups on. If you couldn't do a push-up on this hand, then you probably shouldn't be using your thumb that way. And Rachel, let me know when I hit a really interesting spot. Okay. And that is the actual language I use sometimes. I'm sinking in toward.
I felt something for a brief second and then it went away.
Okay, so to me that means that I probably passed over it, so I'm going to give it another go. And again, I'm going to press in toward her umbilical region.
Well, that right there is painful.
Right there? Okay, do you feel that anywhere other than just under my thumb?
No.
Okay, so take a few easy deep breaths. Even though this one isn't referring, she's got pain right in this area. So I'm interested in trigger points, even the ones that don't refer. And Rachel, let me know when that intensity is dropped by about half, okay? Thank you. And massage therapists, breathe with your clients. If you do that enough, eventually you deepening your breath will cue your clients to do the same. And it's a good chance for you to take some easy breaths yourself. Rachel, check back in. How's that intensity level?
It's a little better.
Okay, let's stick around for a couple more breaths.
Okay. It's much better.
Okay, good. Alright, so the reason why I stuck around there, one is because a little better is a little better, but it's not great. And two, because I hadn't felt any change under my thumb yet. I'd felt a little bit of softening, but not a lot. So I wanted to wait around until that happened. So now that I've done something a little extreme and pinpointed, I'm going to smooth this area out. Okay, so next up, I'm going to work in the gluteal region. My areas of interest are the SI joint, where she has reported some pain, as well as the hip rotators, and of course gluteus maximus, which is a big powerful hip extensor. Previous to this in this session, we've worked with the hip flexors. If you'd like to see a video on that, you can click right here. And now we're going to work with the hip extensors because these two are in a bit of a struggle. They're in a bit of a tug of war. I'm going to start with some nice spreading strokes, just grabbing that low back hip fascia and spreading it downward, tractioning it down toward the greater trochanter. Of course, with myofascial release, we're thinking origin to insertion and beyond. So I'm going to go past that greater trochanter, using a nice broad palm so that I'm not putting too much pressure on that bony prominence. Using reinforced hand allows me to do half the work. And what I'm feeling for with my hands is that melting sensation. This tissue getting softer and letting movement happen more easily. I'm trying not to move faster than the tissue would like to allow. So now I'm spreading laterally. With my other hand, I'm spreading away from my fist. If you work with myofascial release enough, that's just something you're going to find yourself doing with your hand that isn't otherwise working. Most of the work is being done by my fist here, but my other hand is providing comfort and it's providing traction to that fascia in another direction. Is that too much?
That hurts right there.
Hurts right there? Okay, I'm going to try to find that again. Let me know when I'm right back on it. Feels like we're in the gluteus medius minimus region right here.
Right there.
Right there? Okay. Now is that too much? Or is that okay?
No, it's fine. It's just painful.
Okay. Now take some easy deep breaths. And we're going to wait for that intensity to go down. This other hand again is just there to provide comfort. It also takes some of my weight so that I'm not having to lean. I'm not having to support my own torso, which is nice. It's a very lazy way of going about massage. Rachel, check back in. How's that intensity level?
Better.
Good. Alright, so I would continue on down, search for trigger points around here in gluteus medius / minimus. I would work with these hip rotators, see if there's anything interesting through there. I'd also like to investigate this SI joint. So find a tool that works for you. You can use fingertips, you can use thumbs. I'm going to use a soft fist just because this is my favorite. It's easy for me. Again, tractioning in the other direction with the other hand and providing some comfort. And Rachel, is there anything interesting right there?
Yeah, a little bit of pain.
Okay. Now, are you feeling that anywhere other than just under my fist?
A little bit right here.
Okay, so it's traveling upwards. Alright. I want you to keep an eye on that upward referral. Take some easy deep breaths. Let me know when that has receded a bit. And we could continue working down this SI joint toward the coccyx. I would probably stop about right here just for decency's sake. Just do some nice spreading between these two areas, the hips, the low back, and the upper back. It's all connected, man. And I would repeat on the other side. And you can always work with the fascia up toward the cervical region. And you can work on this from across the table. Lots of different ways of working with this low back. But those are just some tricks that I use. Let me know what you think. Let me know if you have any questions in the comments section. Consider subscribing, and I'll see you next time.